We are prepared as girls for puberty, but we don't get prepared as women for menopause. The biggest thing that I have ever heard with menopause was hot flashes. You may or you may not get it, but it's beyond that. There are so many symptoms, and it's so much more bigger than just hot flashes. It's like you're fighting against your femininity, and that can be very, very frustrating. I will say menopause can be very creative. Having your body go through this hormonal change will make you feel like you are about to lose it. I did realize that I needed more information. The fear was taken over. I was suffering with all the symptoms, and I needed to find a way to have a better quality of life. I needed conversations, not assumptions. I didn't need social media opinions. Another list of questions was, where do I start? What do I read? Who do I follow? Where do we get education from? So one of the books that I highly recommend, and this book is from a leading OBGYN, and she's an expert on menopausal and post-productive health. It put a lot of things in perspective for me. It's titled, Hey Girls, Hey! This episode of MenoTheSis is proudly sponsored by Beating Heart Health for Women. At Beating Heart Health for Women, the mission is to educate, empower, and advocate for women through every stage of life by creating spaces where conversations about women's health are welcomed, resources are accessible, and every woman feels seen, heard, and supported. Ladies, we are excited to invite you to our 2026 inaugural Menopause Awareness Summit on Saturday, October the 3rd, 2026, right here in Apopka, Florida. Join us for an inspiring day of expert speakers, meaningful conversations, wellness experiences, community, and education designed to help women thrive, not just survive, the menopause transition. Tickets are on sale now. Click the link in the description to reserve your seat today and join us for the 2026 inaugural Menopause Awareness Summit. Now, are you a women-centered business, wellness professional, or an organization? We'd love to have you as a vendor. Click the vendor application link in the description below to apply and showcase your products or services to women from across Central Florida. If you're interested in becoming a sponsor, partner with us to advance women's health education, wellness, advocacy, and awareness while demonstrating your organization's commitment to empowering women and strengthening our community. Click the sponsor link in the description or visit bhhforwomen.org and select the donate page to learn more about sponsorship opportunities and support our mission, because together we are changing the conversation around women's health, one woman, one family, one community at a time. See you at the summit.
MenoTheSis, her heartbeat is the power of the world. MenoTheSis.
Hey girls, hey. Welcome back to MenoTheSis, where we turn knowledge into power and conversations into community. I am your host, Dr. LaShonda Bailey. Now on episode 3, Veronica and I discussed an episode titled Menopause Preventative Care. And honestly, we were blown away by the response from that particular episode. The messages, the comments, the questions. Women were reaching out to us saying, nobody ever told me this. I didn't know that that was a symptom of menopause. I wish I had known this 10 years ago. And that is exactly why I am doing this follow-up episode. Today, we're answering questions, sharing resources, talking about what I've learned, and helping you build your own menopause teams. I will say one thing that I have learned is that you do not have to navigate menopause alone. So I am going to start with the webinar. We mentioned numerous times that we've learned different tidbits and different snippets and different information that was mind-blowing and game-changing for us from that webinar. Now, the webinar that we attended was a women's health webinar with Dr. Sharon Malone. Put the link to the webinar below, and all of this information will be in the follow-up show notes, so you can be able to access that information. Now, for me, one of the biggest takeaways in that episode was that women should start learning about menopause long before menopause starts. Now, that was mind-blowing to me because I did not really dive into researching menopause until I started having symptoms, until I started talking with my group of girlfriends that are my age. Our body's changing, we're changing, we have questions, we're talking to each other. And it's those aha moments that we start discovering things, right? I saw my mother hot flashing. It did not click, it did not connect to me that that's what she was going through. So I took that as one of my biggest takeaways, because had I educated myself back then, I think I would have approached menopause differently. I know I would have been aware of it. I know I would have been looking for it. I know I would have been educated enough to know what the symptoms look like. And once my body started, I would have gone to the doctor earlier to have those conversations. What I realized is that we are prepared as girls for puberty, but we don't get prepared as women for menopause. Nobody sits us down in our 30s and say, here's what's going to happen to your body one day. And I wish I would have had that information. That changed my perspective completely when I went to this webinar. It made me realize that my audience is not just women age 45, 55 to 65. It's women in their 30s, women in their early 40s that may be going through this perimenopause phase, that those women need information before the symptoms even begin. Now, another list of questions that we saw repeatedly was, where do I start? What do I read? Who do I follow? Where do we get education from? So one of the books that I highly recommend, it's titled Grown Woman Talk by Sharon Malone. This book is a practical guide to aging and health for women who have felt ignored or marginalized by the medical profession. And this book is from a leading OBGYN, and she's an expert on menopausal and post-productive health. That book put a lot of things in perspective for me. It built up my advocacy for myself. It built up my voice where I can be able to speak, ask questions, follow up, have my doctor to sit down and really explain things to me, go over my blood work and all those type of things. The book does an excellent job explaining women's health across different stages of life. So I will put the link below to that particular book, and I did order it off of Amazon. Now, I have another favorite book. It's called Estrogen Matters. This book is by Dr. Avram Blooming and Carol Tavares, and they are advocates for the benefits of hormone replacement therapy, HRT, during menopause. The link is below. And this book is also particularly important to me because I had significant fears about hormone replacement therapy. I have shared with you all that my sister passed away from endometrial cancer. So when I naturally approached menopause and treatment, I was terrified. This book helped me to understand the importance of looking at full body evidence and having informed decisions with my healthcare providers. Most women, when they think menopause, you think hot flashes. That's what it is. The biggest thing that I have ever heard with menopause was hot flashes. You may or you may not get it, but it's beyond that. There are so many symptoms, and it's so much bigger than just hot flashes. Women experience things like brain fog. That was my first symptom that I noticed. Fatigue, sleep disturbances, joint pain. Can't get enough of that. Anxiety, depression, mood swings. I had it all. The weight gain. The weight gain is so disrespectful because the weight comes specifically in the midsection for women. Low libido, dry skin. My skin have changed so much in this part of life since I'm going through menopause. It's dry, it's flaky. I have to keep changing moisturizers. I get to the point that some nights I can't even moisturize because when I have the hot flash, it's a terrible mixture. Some women have hair thinning. I mean, I could see where it can put you in a depression as a woman getting to this age, getting to this stage of life and having all of these symptoms and also having your hair thinning or falling out. It's like you're fighting against your femininity. At least that's what I felt like. You have hair growth in places that you absolutely do not want it as a woman. And that can be very, very frustrating. I will say menopause can be very creative in making you realize that having your body go through this hormonal change will make you feel like you are about to lose it. And I feel that that's so unfair. And I always say my little saying, I would rather have a period for the rest of my life than having my body off and trying to go down a scavenger hunt to find medication that's unavailable, to have to take so many supplements and make all these doctor's appointments and a whole list of specialists just so I can balance myself. I will say that that part is frustrating, but I will say it's also liberating because you become a true health advocate for yourself. And not even just for yourself, for the people that you love, for your friends. Sharing information is powerful. And that's one of the reasons why I'm here doing this. I mentioned that there is a menopause guide that has 30 menopause symptoms. I keep mentioning there are 30 menopause symptoms. So we do have that guide and it will be available in the show notes as well. And I will post it on our website, MenoTheSis.com, because many women don't realize that what they're experiencing may be connected to a hormonal change. And you may see something on that symptoms list that you did not think that was related or may be connected to menopause. So we will get that posted for you all. One of the most important things that I am going to discuss today is building your menopause team. Now, I love that phrase. And what that phrase means for me is that you're creating a group of healthcare professionals who can help support your overall wellness. Now, that team may look different for every woman. It may be your gynecologist, your primary care physician. It may be your pharmacist. There's a lot of pharmacists when they are filling your prescription, they will have a consultation with you. They will have a conversation with you just to let you know about side effects, maybe for different medications. If you're on one thing, how two medications may be interacting with each other, where your doctor did not think about these two medications clashing. So, a clinical pharmacist is a good person to have on your menopause team that you're building. A nutritionist. I know for me as a bariatric patient, a nutritionist is very, very important to the success of us losing the weight. They teach you about protein, how important it is, how many grams you need for your body. So having a nutritionist to help you with the sugar cravings, what to substitute. So instead of having a piece of cake, maybe you'll have a handful of grapes. Just having that person on your team would be a game changer. It would make a big difference because a lot of my hot flashes, I notice, is triggered by certain foods I eat. I know if I have a overload of carbohydrates break down to sugar, my body will go into overdrive. If I have too much caffeine, I will suffer those consequences. I will hot flash, and even worse with a bariatric patient, I may have dumping syndrome. So it's very important to build your team specifically for your wellness. You may have a mental health therapist on your team. I believe that is very, very important. The therapist could help you regulate your emotions. They can help you with the emotional waves. They can help you with the emotional eating. I mean, you have your nutritionist, but to have someone that you can speak to about late night snacking, I'm going for the cookies, I'm going for the chips. that comfort food when you're feeling unbalanced. A fitness professional, someone that's a fitness trainer, that you can get a trainer at the gym. When women, we go into this phase of our life, we lose muscle mass. Having a trainer to help you build up muscle, having a trainer to help you to do the exercises where you can build up your body to have more strength, that would be a very important person to have. Not every woman needs all of these specialists, but every woman deserves support. You deserve to feel heard, and you deserve to get to a place where you are advocating for yourself and you are able to speak openly with your healthcare professionals and ask all the questions that you need. Now, this is personal for me because I spent years afraid of hormone replacement therapy. My fear was rooted in my family medical history, but eventually I did realize that I needed more information. The fear was taken over. I was suffering with all the symptoms, and I needed to find a way to help me have a better quality of life. I needed conversations, not assumptions. I needed research. I didn't need social media opinions. Now, the groups that we're in is very helpful. I am in many women's groups. I am in a hormone replacement group for menopause. I am in a holistic menopause group. I am in a bariatric group. While those groups are very supportive, those are a lot of women in those groups that are sharing stories, that are sharing supplements, that are sharing diet plans, that are sharing different kinds of medications that they try. But those groups should not replace the advice of a medical health professional unless they are medical health professionals within that group or that are administrators of that group, right? This is where advocacy comes in, not telling you what decision to make. But I am encouraging you to have informed conversations with these doctors, that you can ask questions, that you can talk to them in real time, what's happening to me right now, because only you can communicate what's going on with your body. Nobody else can. And you deserve to be heard. Now, for me, I want to talk about something happening to me right now with my estradiol patch. It helps me tremendously. I'm to the point where I am on a regimen, so I'm on a low dose estradiol patch, and I take progesterone at night, and I have testosterone cream. So with that combination, I'm doing okay. But every refill, when it's time to get my patch refilled, I feel like I'm going on a scavenger hunt. I go to one pharmacy, they don't have it. I go to another pharmacy, out of stock. I call my doctor. I'm moving prescriptions around. I'm going from one pharmacy to another pharmacy. Now I'm going to the grocery store pharmacy, and it is so frustrating. I mean, it's stressful because I found something now. It took me a long time to get here. And now I found something that actually helps. And every time it's time for me to refill that prescription, I get a level of anxiety that you will not believe, because I am accustomed to my medication being out of stock or unavailable. And I have to literally go down the phone book and call all of the local pharmacies in my area, and sometimes outside of my area, just to get my prescription filled. And even when I find a pharmacy that has it in stock, I have to wait for business hours to call my doctor's office to have them now to write a new prescription to move it there. So you're talking about stressful, and it's stressful for me because it's working and I'm balanced, and now there's a threat to that. So it gives me grave anxiety that now my treatment may be interrupted, and now the hot flashes are going to come back, the night sweats, because when I started having hot flashes, I was having about 6 or 7 little spurts, little hot flashes per hour. It was so uncomfortable. It was so disrespectful. I'm like, what is going on? It was like my body was fighting. Like I'm fighting my own body just to regulate. And every time it's time to fill the prescription, I have a flashback to those moments when I wasn't feeling good, where I'm hot flashing, where I'm riddled with anxiety at night. So I would tell you, ladies, even though that is frustrating, Don't stop advocating for yourself. If one pharmacy don't have it, call another. Talk to your provider. Ask questions. Keep going. What I have found in those social groups and speaking about my frustration, there are women going through this as well who offers advice. One young lady told me to try Amazon. I had never thought of going to Amazon to fill my prescription for my estradiol patch. Another young lady said to me, try mail order. And with the mail order, you are not going to the local pharmacy chain where everyone is going through the drive-through or running into the pharmacy to fill their prescription. You can actually start before your prescription run out. They will give you a call and check everything in the system and have it on its way. I think that's amazing. What I have found is to try the local grocery store pharmacy. I have had better luck since I have changed my prescription there. And what I've also done is I have my prescription for 90 days. So my doctor, instead of 30-day prescription, she's written it for 90 days. And now I have 3 months. Well, at least for at least 60 days, I don't have that anxiety because I have 3 boxes of patches, which has been much better for me. So a few questions that you can discuss with your doctor about building your menopause team. Could my symptoms, the symptoms that I'm having, be hormone related? If so, what treatment options are available? With those treatment options that the doctor gives you, what are the benefits? What are the risks of each of those options? Should I have blood work completed? Now, when you have the blood work completed, I would suggest that you make a follow-up appointment where you can sit there and your doctor can go through your blood work with you and explain to you your levels, where you are, the high range, the low range, what that means for you, what your blood tests are. That would be a very informative conversation or appointment to have. If this is your PCP that you're going over this information with, that you're at this appointment with, you maybe can ask the PCP, would a specialist be appropriate? Do I need to call my gynecologist and make an appointment? Or is there another doctor, maybe an endocrinologist? Just depending on what your blood work say, then you can make an informed decision as to would a specialist be appropriate. You can also ask, are there lifestyle modifications that may help you? A lot of women don't want to go straight to medication, hormone replacement therapy. They want to approach it holistically. If that's the case, you should absolutely be able to discuss those options with your doctor. Don't be afraid to speak up. Medical healthcare professionals, this is their job. They've been doing it for a long time. They are experts in this field. What you are an expert in is you are an expert on your body. Okay? Don't forget that. Now, ladies, menopause is not something that you survive. What I'm learning is that menopause is something that I am navigating. And the more information I have, the better I equip myself to advocate and make better informed decisions. Always remember, knowledge is power. Research is a good way to inform yourself about something that's out there that maybe your doctor doesn't even know, and you could bring that to the appointment for a discussion. So with this episode, I would encourage you to visit MenoTheSis.com. That's where I'm going to drop all of the information that I mentioned today, the webinar link. I'm going to put the 30 symptom guide for you for menopause. I am going to link the book by Dr. Sharon Malone, Grown Women Talk, and I'm also going to link the other book, Estrogen Matters. You can also visit bhhforwomen.org. That's our newsletter. I will have some informative information monthly. Anything that I find out within this menopause realm, I will certainly let you know. And our next episode, we are tackling one of the biggest questions that women have been asking us for, or has been asking us, and it's, am I okay? So with that episode, we are going to bring a special guest, which is a licensed mental health professional, to talk about menopause, emotional wellness, anxiety, being overwhelmed, and all of the emotional shifts that women experience during this season of life. Also, ladies, before I leave tonight, I wanted to let you know that we have a 2026 inaugural Menopause Summit. So if you are in Central Florida or the Orlando area, we have something special for you. One of the reasons I created MenoTheSis and Beating Heart Health for Women is because I believe women deserve access to education, resources, experts who can help you navigate this journey with confidence. Now, that's why I'm excited about our summit. It's on Saturday, October the 3rd, 2026, from 11 a.m. to 3 p.m. at the Apopka Community Center in Apopka, Florida. Now, this is going to be an amazing event, ladies. We're going to bring together a panel of experts, including a menopause team. We're going to have a board certified gynecologist, a clinical pharmacist, a licensed mental health therapist, and a nutrition specialist who will share information. They're going to answer questions, and they're going to help women better understand their health and their wellness options. Now, the best part is that you'll have an opportunity to hear directly from these experts, and you'll be able to get your questions answered in real time. So whether you are in perimenopause, you are in menopause, or you're like me, postmenopause, or you simply want to prepare yourself for what's ahead, this event is designed with you in mind. So save the date, ladies. It's October the 3rd, 2026. Tickets will be available, so visit vhhforwomen.org and click on our events page, and you'll be able to purchase your ticket. We would love to see you there, because we all know when women come together and share knowledge, we support one another, powerful things happen. And trust us, this event you don't want to miss. So I can't wait to see you at the summit. Happy hormones, ladies. Hey, girls. Hey.
MenoTheSis.